Health Leader Evaluation by Quantez Spears. Health models. Health models are very helpful to leaders in framing and structuring the organization. Health models help health leaders in making decisions. According to Ledlow, a key justification is that success in improving organizational performance and outcomes rest primarily in the competent leadership of the health organization. Also, promoting competent leaders to higher levels of responsibility in the health organization is of utmost concern. Again, health models help guide and aid leadership development by providing steps and information in the leadership. The health models that we're going to be looking at and reviewing today are the GE Institute for Transformational Leadership Development Variable and Process Model, and the National Public Leadership Institute Model for Leadership Evaluation. We will look at how to apply these models, the similarities between the models, differences between the models. Finally, we will choose which model is best to be implemented and why. Similarities in the models. The similarities between the GE Transformational Leadership Development Variable and Process Model and the National Public Health Leadership Institute Model of Leadership Evaluation is that both models focus on developing the leadership skills needed to guide their organizations. And both models are useful for the improvement and development for leadership and for the organization in structuring leadership plans. Comparison of models. When comparing models, one, we look at the GE Institute for Transformational Leadership Development Variable and Process Model. The GE Institute for Transformational Leadership Development Variable and Process Model creates focus and development by prioritizing key events, logical and consistent and predictable, by having discipline or remaining in the scope. Strategic initiatives such as being clear, narrow, and focused to simple and organizational alignment. Defining And activating a strategy includes coming up with a strategic plan, an operational plan, and setting goals and objectives. Goals and objectives that are usually individual level or aligned with strategies are measurable. When leadership can engage the organization, this focuses on the values, competencies, and behaviors, which will help with growth, change, integration, and culture of the organization. Performance management, talent reviews, which focuses on talent calibration, succession plans, and organizational staffing. In driving results, getting operational reviews and focusing on skill development, leadership skills, change management, and performance methodologies. The National Public Health Leadership Institute model of leadership evaluation focuses on individual leadership development, which has a greater understanding of skills and valuing of certain approaches in public health and leadership, understanding validation, and understanding self as a leader. Ways to help measure leadership include tests on emotional competence, on emotional intelligence. Emotional intelligence is needed by all leaders to be effective in healthcare. Leader actions, patterns, staying put, addressing issues, and taking on new jobs. Public health systems and infrastructure development focuses on program change and development, organizational change and development, policy change and development, and system change and development. Network development focuses on the national and organizational and state levels, and how leadership will interact with the public. Best model to use. The GE Institute for Transformational Leadership Development Variable and Process Model. Transformational leadership has identified as one of the most effective styles in health services. In transformational leadership, a leader mobilizes followers' motivations toward an organizational vision by empowering the staff, challenging them beyond the status quo, and recognizing their individual needs and inspirations. This approach has resulted in positive organizational performance and has improved on nurse retention, on healthcare personnel retention, and care outcomes. Ways of measuring effectiveness of transformational leadership include surveys on leadership from peers, patients, and other stakeholders in the organization. Surveys will provide feedback on the leader. Surveys can be used for quantitative and qualitative data. Qualitative data would be describing the leader, characteristics of the leader, describing specifically their strengths and their weaknesses and areas of improvement, or areas where they show their most strength and confidence. Quantitative surveys will be rated on a scale of 1 to 5, or with scales such as agree, somewhat agree, disagree, somewhat disagree, or agree and agree. Leadership can also be measured by objectives. Using goal setting theories, leaders and stakeholders set goals either in months to a year or to 2 to 5 years, and will be measured and monitored to see how the leader is doing in the organization. Emotional intelligence tests can be completed by the leader as well. The end.